Global Exchange Hub. I'm Barbara Sam. This is a space where we exchange ideas, foster collaboration, and encourage community involvement. We're sharing stories of inspiration and following dreams and also the American dream. Joining us is dentist Dr. O. Welcome to the show.
Thank you, Barbara.
It's a pleasure.
I'm really glad to be here.
So, Dr. O, tell us about your background as a dentist and also your vision for Visionary Smiles.
Yes, starting Visionary Smiles has always been a dream, dating 15 years back. Being a dentist in Nigeria, I've always had a dream to get the best training, which comes from America, really. So it has been a dream to come to school in America and be trained as a dentist, even though I was already a dentist. And eventually open my own practice. So, and that is what is happening now. So I'm really great. I'm happy to be here.
So you were a dentist back in your home country, Nigeria. Tell us about that experience.
Being a dentist in Nigeria was great. It was because there are just few of us, so it was a great chance to touch many lives, help people who are hurting, people who, don't have access to great, medical care. But much more than that, practicing dentistry in Nigeria was not at the cutting edge. We were not maximizing the best of technology, which means that we were not, helping patients as good as we could have helped them. So it has its advantages and disadvantages, I would say.
Okay, so fast forward to you open your practice here, Visionary Smiles. Talk about some of this technology and innovation that you use in your practice.
Oh, okay. This is exciting for me. In my practice, everything is digital. Patients book online. They
Mhm.
fill their forms online. Pretty much before they come, everything is done. And when they come in, we check them in, with iPads and all of that. And then when they come in, we take X-rays, which are grade A, high technology X-rays. We take 3D X-rays, 2D X-rays, all of that. And when you have good X-rays, diagnosis is very straightforward. It's easier for you. And also, when we want to do crowns or do any restorative works, we have scanning machines that can take 3D representation of your mouth, and that can be sent to the lab, and that helps them. Also, we have milling machines, so you can have same day crown in my practice, which is I would say is very, very recent in dentistry. So those are some of the high technology that we use at the moment.
So it has been reported that the one of the number one fears that people have is going to the dentist. Why do you think people have that fear? And then also to share with us some of these personal care services that you provide to your patients to ensure they're comfortable, to walk them through their procedure, and to ensure that they are comfortable and they come back for that regular routine checkup.
So one of the main reasons why people have fear of the dentist is because before now, we do not have much understanding about how we can manage pain. So we just did what we needed to do, even though it hurts or whatever. But now we have much more understanding of how we can manage pain. And first thing is you explain the procedure to the patient so that they have an idea what they are going to have done to them. You take them through the process. And also we have several things, like if you want to give a shot, we have gel that we can apply so that you don't feel the shot as much. We have things to distract patient, like I have TVs in the ceiling, while they lay down, they could be watching a show that they like, and I can do my work. Different things. We have medications we can prescribe to make patient relax. We have nitrous, we have sedation. So there are so many options now that can make dentistry easier for patients.
Can you talk about the importance of cosmetic dentistry and how this helps to enhance a person's smile?
Oh wow, that's one of my favorite topics. So thank you for that question. There's a saying I say that there's nobody unattractive until they smile.
Mm,
Yep. So your smile is your confidence.
yeah,
If you
it's
can
very true.
smile, it's a sign that you are confident. And most people cannot smile.
Why
So
is that?
because they don't feel they have great smile.
Okay.
Maybe their teeth is shifted in a way, they have spacing, opening, or a tooth does not look great. And so they don't smile, they don't take pictures. But that's where we come in. We try to get you a great smile that now makes you confident. And a lot of people have done smile, change their smile. They pursue their dreams even better now. So it's important.
So with oral health, it's really important to maintain your gums. So can you give us some tips on how viewers that are watching can maintain their oral health? And then also to people that are having issues with their gum, what do you recommend to them?
Uh, Oral hygiene starts with you, just like any hygiene in general. You have to be conscious of your mouth, which involves your teeth, your gums, your bones, your tongue, and all of that. So I would say brushing, you know, once at least. When you eat food that you know can give you bad breath, you want to rinse out or chew something minty that can diffuse this or that can put down the smell. Also, you have to build up an habit of seeing the dentist at least once or twice in a year. Most people don't do that, but you have to because we are the ones trained to look in your mouth and see what's going on and then quickly correct before it gets worse. So and then use mouthwash. Um, yeah, those are a few things that I think we could do. Flossing, that also is important. So yeah,
So you mentioned that you need to come and do a regular checkup once or twice a year. A lot of people don't do that. Why is that?
financial. A lot of people feel like, oh, I don't have money. The dentist is expensive, and most people don't have insurance. So those are a few reasons why people don't do that. But I would advise if you can, you should.
Some of the tips you gave was flossing and also doing rinsing with mouthwash. There is a really big trend now with oil pulling. Do you know about this trend? Talk to us about that.
Oil pulling. I've heard about it, but it's not scientific. It's not. We were not trained about that in school, so I really don't understand the concept of oil pulling.
So, for those that don't know, oil pulling is using coconut oil as a way to, uh, in replacement of mouthwash. You use it, you gargle, you rinse your mouth with it. And it said that it has antibacterial properties. So that's why people are starting to use oil pulling and also whitens your teeth. It's something that I do, actually. So, Dr. O, it's interesting that you're like, oh, it's not something that's scientifically proven. I think it's more of one of those homeopathy or one of those like holistic practices.
Mhm.
But it's something that I do. So I don't know. Maybe I
So,
shouldn't have mentioned that,
so,
but
so let me ask you: do you think that it works for you?
it works. I see a difference as far as how it brightens my teeth. So in that aspect, it works as far as antibacterial properties and all of that. Again, I'm not a dentist. That's not my profession. We are with a professional. So I'll be able to get some more insight. And do your own research.
Yeah, I
Okay.
would go check it out now that you're mentioning, and then I'll have better answer next time.
Yes. Okay. So share with us some of the success stories that you've had with your patients that you've seen.
Wow. Have a lot of success stories. Um, there was a patient who came. The dentist had told her, there was nothing they could do about the tooth. She actually came to pull the two of those teeth, and they are somewhat in the front. When she smiles, it can show. And she's single, she's young, she's trying to, come up and, start dating, and all of that. So when she came to me, um, I immediately told her, yeah, I can fix this. I've done this
Procedure before.
before a
Okay, so
lot of
you've done
times.
the
So,
procedure
so
before.
yeah, so in that case, we went in, look at the tooth, did the root canal, we put post in there, we did the crown lengthening, we opened some of the teeth up, and then I did build up on a crown, and then she's very well, smiling how she talks about me glowingly, and I'm really happy for her now. She can date and she can move on with her life.
So for a lot of people that's watching, can you explain to us exactly what a crown is?
Um, a crown is
Just like in the most
lame.
basic, simplest explanation, because we hear all of these terms and it's like, okay, maybe I know someone or maybe myself have gotten a root canal, right? So I know what that is. Um, but what is a crown?
So, in a layman's term, a crown would be like if you have a hair, like as a woman, and you don't like your hair, it's not long enough, it's not dark enough, and then you go get a wig.
Okay.
Yeah. And when you're choosing your wig is long like you like it, it's the color you want, you know. So crown is a perfect tooth for a tooth that's not perfect.
Okay, so it's just pretty much you're covering something.
Correct.
Okay,
And
so
then it serves for the functioning and then for the looks and all of that.
so it's not surgery.
No, it's not.
Okay, so a crown, what's the difference between a crown and veneers?
Okay. So crown covers the old tooth,
Okay.
but veneers covers just the front and the top of the tooth.
Okay.
Yeah, so the back is still the tooth, but the front is covered by porcelain or composite, whatever material is used for the
Okay.
veneer.
A lot of people have this misconception, and also you can correct me, that in order to get veneers, you have to shave down your teeth.
So there are two parts to it.
Okay, so explain to us, for people that's watching that's maybe interested in getting veneers, explain us and walk us through that process.
So if your tooth is small, um, naturally, and we want to give you a better smile, and you need veneers, we would not need to touch those teeth because it's already small. So we're just gonna bond the natural teeth that it should look like or it should be. We put it on top of the tooth and cement it permanently. You don't need prepping in that case. But if your tooth is normal or is already big or it's like and you want something more aesthetic, we will have to reduce those teeth so that we can put the veneers that will make your teeth come back normal. Problem is that if we don't reduce it and we just put something on top of it, you are not going to be aesthetic. It's not going to be a good smile anymore. You're going to look bulky, and then some people call it horse teeth and stuff like that. Yes, that's the concept where we prep, shave a little bit, and then give you something perfect.
So I know it's a big trend right now. We see it all over social media where people are going to Mexico, they're going to Colombia, they're going to different places outside of the US to get these type of cosmetic procedures. So talk about some of the dangers and risks involved in that.
I mean, it's a good thing that people really care about their smile and they're going to travel, go an extent to get it done. But the challenge is that most of these people they go to see, we don't know their training.
Mm-hmm.
We don't know what materials they use, or it's not regulated like in America. If a dentist does something bad, there's board. The patient can report to the board, and there's regulation. You get what I'm saying? So when you go out there and get all these veneers done, I have a case right now in my practice where she had gone to do veneers in Colombia, and then her gum won't stop bleeding. When I saw her and I checked, those veneers have no margins. They just put something on the teeth, on the gum, and then food can hide there and then start to irritate the gum. So there's a lot that can happen. And also, if you have complications, would you keep going back and forth? So those are things that we look at when people travel.
So you said that you have a patient that went to Mexico that got veneers and now her gums are bleeding?
Yes, correct.
Wow. Okay, so you're treating this patient
Yes,
right now.
Yes.
Okay, so can you give us some insight without, of course, there's HIPAA laws and things like that. You can't reveal a lot of information, but can you just give us some of the procedures you're doing to correct this?
We have to redo the veneers, all of them. And then cleaning, we have to do deep cleaning, we have to do laser treatment. Those are the things. And then put on oral things, mouthwash, things that she can use to keep her gums healthy. And then while we do this treatment that we have to do for her.
Okay. Thank you so much. We're going to take a break and be right back. to Global Exchange Hub, having conversation with Dr. O of Visionary Smiles, sharing with us the importance of oral hygiene and care. So, Dr. O, you were telling us about a patient that you're currently treating that went to Colombia for veneers and just having to redo that entire process and procedure all over again. Yeah.
Yes, like I was saying, there are so many cases, this is not even the only one. There are cases where dentists will put bridges on teeth that cannot be restored. It's just a lot that we see, and sometimes it's too late when they come. We have to pull teeth, we have to do implants, or, do a lot of more expensive procedure that could have been avoided if you had come to the right people. So yeah, we see this a lot, and we keep spreading the word that come to us. It may seem expensive, but at the end of the day, it's not. It's your body. Your body is your highest prized possession. So yeah, nothing is too expensive for your body.
So, for people that are interested or want to have veneers, it's better that they spend a little extra money and have the procedure done in the US because there's rules and regulations that protect you. And then also too, there is what is it, a quality assurance?
Yes.
What
Like there's a standard, but you are sure of what you're getting. Even if it's a bad dentist in the US, there's regulation. You could sue, you could get a lot of money back. But when you go somewhere that nobody knows what anybody is doing there, you are just you are at the risk of a greater loss and damage.
So there's a great loss and risk associated with traveling outside of the country to do dental procedures, cosmetic dental procedures, without it being regulated.
Correct.
So thank you for sharing that with us.
Well,
So I want to share with you guys a report by the World Health Organization, and this is from a 2022 report, Global Oral Health Status. The report estimates that 3.5 billion people worldwide are affected by oral disease, with 3 out of people living in middle to low income countries. It also reports that inadequacies are similar to non-communicable diseases such as cancers, diabetes, and mental health disorder. So talk to us, Dr. O, about some of the work that you did doing dental missions.
yes, I love dentistry. It's my life and passion. So whether I'm paid or not, I do dentistry. So yeah, back while I was in Nigeria, I'd gone for several missions, and that is free. We just using our services, our skill to help people who cannot afford it. So I've gone to different places in Nigeria and even outside of Nigeria to Guinea-Bissau, Gambia, Cameroon, different places. And even here in America, I've worked in rural areas. I've worked in places where people cannot, afford a lot of, dental procedures. But I can attest to that. Oral diseases is everywhere. It is mainstream. It is a lot. So yes, we should take it serious.
Share with us that experience and journey working on those mission trips in Guinea-Bissau and also Nigeria to provide free medical, free dental care to people in need in low-income countries.
Usually an exciting time because we go usually with a group of us dentists. Usually we're friends, dental assistant, lab technologists, all of those. And then we go usually in a bus if we're going within Nigeria. But if we're going outside, of course, we fly. And then we're usually in a hotel or in someone's house or maybe the king's house or somebody's house. And we eat all together, we go through the same conditions that people in those areas go through, and then we're able to connect with them, help them, listen to them, and just do great work in the community.
What are some of the things that you've seen when you had these clinics set up? Talk about some of the dental issues that you saw, some of the oral hygiene that you saw, because these people don't have access to the same type of services and systems that we have.
So usually there's a lot of bad teeth. People have been hurting it for a long time and they have no means of, dealing with it. So in a bad state that they have to have a pull. So we usually have a lot of teeth pulling, a lot of extractions. We have to do a lot of cleaning because people have not had their teeth cleaned in a long time. We do a lot of dentures. We do a lot of fillings here. So those are kind of the things that we see, and a lot of infection. We give antibiotics, things like that.
So, in these low income countries, how are they able to sustain proper dental care if the services are not available?
So, well, a situation can be a blessing or a curse, depends on how we see it. So, usually when people know they don't have access to care like that, they try to have a very good, you know, home care, oral hygiene. They try to, care for themselves in such a way that, they can you know, be able to survive for a long time. So usually they would have their own ways of cleaning. They have herbs, they have chewing sticks, they have different things that they use that could be antibacterial that, can keep them out fairly, healthy.
Okay, so you've traveled across Western Africa providing oral services um, through mission trips. Who organized these programs for you guys?
It's usually sometimes it's church, sometimes it is even dental school in America here. I've been on a trip where it's this dentist student from Howard University come to, Africa. And then I have friends who contact me and then I come on the trips with them. So different people, organize these trips.
So I want to commend you for your work and thank you so much for just giving back and sharing your gifts and talents to help those.
Thank you.
So, in your own country, Nigeria, where you practice dentistry, talk about some of those challenges and that experience because again, those type of services are not easily and readily accessible to people there.
So practicing in Nigeria was, like I said, was challenging because most people cannot
And
afford treatment. And then when they come, they are limited really financial wise. And when you are limited in finances, your treatment options are limited. So back home, I had to do a lot of extraction. That's why when I do extractions, yeah, people are like, "Oh, how come you can take out this teeth easily?" I've been taking teeth out for a long time.
you
So
have the experience.
yeah, yeah. So
Okay.
so dentistry in Nigeria is very surgical. Like where it's more we do more of surgery than we would do cosmetic or restorative, or because you need technology, you need money, you need resources to save teeth rather than pull them.
Okay, and that's why you have those technologies incorporated and you use these technologies and procedures at Visionary
Yeah,
Smile.
correct. Because I love to save teeth. My favorite procedure is root canal. Every time I say it, people laugh.
Why do you? I don't understand. For people that are terrified to do root canals, why is that your favorite procedure?
So back in Nigeria, everybody wants to pull teeth, but I know that there's better way you can save teeth. You don't always have to pull teeth. So I spend half of my time at the practice in the clinic while I was in Nigeria convincing people why they need to save it. And when they say yes, I am so happy. So I go after the tooth, cleaning out, fill the tooth up, and then they have the teeth in their mouth, and it's good. But now I am in America and I even have better technology. So you can imagine how I'd love to even save teeth more right now.
So, for people that are afraid to go to the dentist, you provide a comfortable, relaxing environment for them. And for those that feel they can't afford it, what type of options do you have for them?
So there are a lot of options. Insurance. Insurance will pay a lot and maybe you just come out of pocket for a little. If you don't have insurance, we have financing options. It's just like you want to buy anything in America. You want to buy a TV, you want to buy a car, you want to buy whatever. There's financing option. And our financing options are even better in that there's no interest and then they pay us the money upfront. You can have your procedure done immediately, and then you have a long time to pay back. You don't have to suffer for that long time. You can have what you need now and then pay over time.
Dr. O, thank you so much for the insight. Thank you for sharing tips of how to maintain oral hygiene at home. I'm Barbara Sam with Global Exchange Hub. Thanks for watching.